Good morning, friends. My co-panelist, welcome to AIDS 2026. Friends, I am Loknath Misra from India, working with Aruna and Indian network of NGOs on HIV/AIDS for last 3 decades. Friends, I am really missing my physical participation in AIDS 2026. However, because of the technology, it made possible for me to participate virtually. Thank you, AIDS 2026, my friends participating. The topic given to me is migration. Friends, migration is not new. People have always moved from one place to another in search of livelihood, for safety and for a better life. Migration is seen across the world. It's not that it is happening in one part, it is happening in the other part, or it's not happening here or there. It is seen in everywhere. The pattern may change, but the main reason remains the same. People move mainly for work and survival. Migration can be divided into 3 major categories. One is step-up migrants. People go for a better life from village to city, city to major cities to other countries. These are the step migrants. Second category is translocation. People don't stay in a particular location for a long time. They move with families from one location to another location to earn livelihood. Third is circular category in nature. Circular migrants. In India, millions of people from villages move from villages to cities, move from cities to cities, move from one place to another, move from one state to another. Among them, circular migrants are very important and considered as vulnerable group of people. They are often single male workers who stay away from their family for many months in a year, while their families continue to live in their villages or in native places. Today I will speak some of the challenges faced by the migrants, more particularly by the circular category of migrants, those who are working in unorganized sector, their access to health services, their access to protection, and their access to support in the workplace. Friends, the first challenge I will note here is the access to health services. Many migrants do not know where to go when they fall sick in a new place. They may not speak the local language. In India, people speak hundreds of different languages, and all are different, not similar to each other. Second point, they may lose one day wages if they will go for treatment to a hospital. Because of this fear, majority of the migrants delay their treatment. They go to a doctor when they fall sick and their condition becomes serious. Regular health checkups, HIV testing, TB screening, counseling and mental health supports are not available at the place of work and at the reach of the migrants. The second biggest challenge, their vulnerability to HIV and other infections. Circular migrants always remain away from families for a long period. They may feel lonely and isolated. Some migrants take the risk due to peer pressure, due to alcohol consumption, due to lack of awareness, poor access to condom or counseling services. They got the infection. They got the infection because of the ignorance, because of the other risk factors. Additionally, stigma and discrimination still prevails very high in India. Many people are afraid to go for HIV testing in fear that they may lose their job. In place of work, if somebody will know that the person is living with HIV, then immediately that person will be disengaged from job, though there is legal provisions that you cannot disengage a person from the job because of the HIV infection, but in unorganized sectors, they don't have any paper backup for them. They don't have any legitimate work. They work on daily wages, so easily they will lose their job. So this makes early treatment and prevention very difficult. The third challenge is poor living conditions. It is contributing. Many migrant workers live in crowded rooms, temporary shelters, or in work sites. They may not have clean drinking water, proper toilet facilities, recreation, safe cooking space. These conditions increases the risk of diseases. When many people live together in a small space, infections spread easily. Poor food, long working hours, and lack of rest also make their life very difficult, make their health condition worsen. The fourth challenge is unsafe workplace. Many migrant workers work in construction sites, small factories, transport industries, agriculture industries, bricklaying industries, hotels, domestic work, and in many other informal sectors. Often they do not get safety equipments, paid leave, sick leave, or accidental support or insurance support. If they are injured, the immediate consequences they will lose their job, and the long-term consequences they will lose their livelihood. Many do not have a written contract, so become difficult to claim their rights. The fifth challenge then, friends, is the social protection. In India, government is having many social protection schemes, but many migrants cannot easily access those schemes, access the benefit of the schemes because of the identity. The identity card particularly being used, particularly the ration card, the health card, the other identity cards is linked to the native, not to the place of work. Though many people face problems, additionally, many people face problems getting services because of the identity card they are having. And second thing is the language in the workplace. Third thing is lack of information. And fourth thing is the complicated paperwork. So benefits do not always reach to the migrants when they need it the most. The sixth challenge, friends, is the financial insecurity. Most migrants earn daily wages. If they do not work for a day, they may not get paid for that particular day. Additionally, they have to send money to their families for their survival. So migrants having a little savings with them, a small accident, a few days or 1-2 days job loss, or delay in getting the wages, push them into debt. They are always dependent upon the labor contractors, the employers, or the money lenders. This makes them more vulnerable, increases their financial insecurity, and their life miserable. The seventh point I have identified is the lack of respect and dignity. Migrants in most of the times treated as outsiders. Their contribution is not always recognized. But we must remember that migrants build our roads, build our cities, build our hospitals, build our markets, work in our factories. They are the important part of our economy, but they are not being treated with dignity and respect. So these challenges makes the life of migrant vulnerable to HIV, vulnerable to infection, vulnerable to many things. So what should we do now? The first thing I would suggest, health services must be made migrant friendly. Services should be reach labor camps, work sites, transport points and slum areas so that migrants can easily access the healthcare services. HIV testing, counseling, condom supply, TB screening, and general health checkup should be made accessible, easy, and with confidentiality. Then the second point, social protection should be portable. A worker should be able to use whatever identity card is having to get the benefit of ration, to get the benefit of health insurance, and get the benefit of the available schemes at workplace. Workplace must be safer. Employee and contractor should provide safe conditions, fair wages, rest, sick leave, and accident support to all the migrants. Most importantly, last point, migrants should be treated with dignity. Migration itself is not a problem. Migration is not something stigmatized. The real problem is lack of access, unavailability of services, lack of protection, and lack of support. Let us remember, friends, wherever workers go, their rights, health services, dignity should go with them. They are the citizens born with inherited rights. So wherever they are, whenever they are entitled to access all these things. And it is the responsibility of the state. If the state, the civil society, the intellectuals can make these things available to migrants, allow them to live with dignity, allow them to get their wages properly, allow them to live with a good health, then they are the most productive population of the nation. So let us decide the entire global migrant population should be safe, informed, and living with respect and dignity. Thank you so much. Thank you once again.